Come to another case study. So this case study is saying start the email below and answer the subsequent questions. Describe what you see, that's A. Then what is the most likely diagnosis on B. Then C is saying list 3 equipments used to assess nutrition status in older children. Then D is saying list 4 fatal complications of this condition. So let's start with the answers. So let me just get rid of those marks. Okay, describe what you see. So what do you see? Of course, there is features of severe wasting. Those are some of the things you can note for, and maybe if you can see clearly, there's some poor mapara. Those are some of the things we are able to see. Then what is the most likely diagnosis? So this is most likely severe acute malnutrition. Then list 3 equipments used to assess nutrition status in older children. So as equipments we use, so we are now on C. So we have Shakia tape, which is the one we used for measuring the upper arm circumference. Also known, other people call it a Muaki tape. Yeah, but it's called the Shakia tape. Then the other thing you can use is the stadiometer if it's an infant, or if it's a stadiometer in older children. That since the question is asking for older children, it's a stadiometer. But if we are dealing with an infant, then it should be an infantometer. Then the other thing is you can do is body weight measurement scale. So you can just measure the weight of the patient. Okay. Then we are done with C. Then D. List 4 fatal complications of this condition. So if you remember the 10-step management of SAM, you have the first two. So we have hypoglycemia, hypothermia, those things are infections. So we have mentioned 3 things already. So hypoglycemia, hypothermia, infection such as pneumonia. Those things can those are fatal complications. Then we also have shock, can have sepsis. Those are some of the things which can cause which are some of the fatal complications of this condition. Okay, so we are done. Thank you for watching. Please subscribe if you haven't subscribed, and hit the bell notification, and check out other case studies as well.